Hey guys, welcome back to another video tutorial from Aditya Biologics. So guys, today we have a very interesting topic to discuss on, and that is hypersensitivity reactions. Okay, so guys, today in this video we are going to discuss from the basics of hypersensitivity to types and its mechanism, and at last we will discuss the management and prevention of hypersensitivity. So guys, stay tuned with the video. It's going to be very interesting today. And yeah, always remember, learning with fun gives you wings. Okay, so now let's start the video. So guys, before starting the video, you need to have the basic concepts of antigen antibody reactions. Yeah, so better go through the videos of antigen antibody reactions on YouTube, yeah, for more clearance. Okay, so guys, hypersensitivity, the word itself defines the term. Yeah, hypersensitivity means powerful sensation, yeah, which is done by the immune system of our body. It is nothing but a powerful immune response against the allergens. Yeah, and what are the allergens? Allergens are nothing, they are the particles. Yeah, they are the particles, the things that stimulates the immune system, immune reactions. That's the allergen. And in a layman reaction, in a layman language, we can say hypersensitivity as the allergy as well. Yeah, whenever we are talking of allergy, we are talking of the hypersensitivity reactions. Okay, and it is nothing but exaggerated immune response. We will discuss in a bit more detail. So now let's move on. Okay guys, so before starting the video, we have some basics to understand about the antigen and antibodies. Yeah, what are the relations? Guys, antigens are any foreign substance that enters into our body, that may be pathogens, dust, whatever. Yeah, and our immune system has a job to stop it, to neutralize the allergen, because that allergen may be pathogenic to our body. Yeah, they may hijack the cellular metabolism machinery and may cause many types of incompatibility into the body. So our immune response does what is, it produces antibodies. Yeah, antibodies. And suppose this is the allergen, then what happens is this allergen fits in the antibodies, and thus the system gets neutralized. Yeah, means we are safe now, it can't perform its task. So now means we are safe now, and that's the job of immune system, to produce the antibody against the certain antigen, and make the condition incompatible for them to cause an infections, disease and all. So this is a basic idea you need to have before going through the video. Okay guys, so hypersensitivity reactions, it is nothing but the inflammatory immune responses induced by repeated antigen exposures, resulting in the host tissue damage. Okay guys, now let's talk about the allergens. Actually, it is a non-parasitic antigen capable of stimulating hypersensitivity reactions. The same thing here, nothing new. Okay, an antigen that produces a vigorous immune responses, in which the immune system fights a threat that is harmless to the body. Actually, most of the allergens are not that much harmful or that much fatal actually for the body, but also it is a false perception of the immune response that the allergen may be harmful for the body, and it reacts very hyperly. That's why it is hypersensitivity. Yeah, that's the term, guys. Okay, now let's talk about the types of hypersensitivity. Okay, four groups according to mechanism of actions into, and they are of four types actually. Yeah, type 1 is immediate hypersensitivity, which we will talk in this video in a bit detail. And type 2 is cytotoxic hypersensitivity. Type 2 is immune complex hypersensitivity. Type 4, also known as cell mediated hypersensitivity, delayed hypersensitivity as well. Okay guys, and we will talk in a bit more detail about the type 1 hypersensitivity reaction, also called immediate hypersensitivity or anaphylaxis. Okay guys, okay, Now let's talk about some of the examples of allergens, what they can be. Okay, so exogenous allergens, guys, they are nothing but foreign particulates like animal products, fur, dander, cockroach calyx, wool, dust mite, excretion, that may be drugs, penicillin, and sulfonamides as well. Food, egg, albumin, corn, legumes, peanuts, soybeans, milk, and seafoods. Guys, they can be anything from outside of the body, and that is exogenous allergen, nothing much. Yeah, okay. The next is insect venom as well, mold spores, of course, plant pollens, hay fever, yeah. And another one is endogenous allergens. They are self antigen. Actually, they are the proteins, body proteins, the signaling proteins inside the body that sometimes acts as the allergen for the body itself, and they are called the endogenous allergens. Okay, guys. Okay. Now let's talk about the type 1 hypersensitivity in a bit more detail. And before going to the details, I would like to give us some mm, brain frame to understand in a bit more detail and clear. So guys, actually what happens is whenever any antigen, suppose this is the antigen, okay, whenever an antigen enters into the body, then it actually what does it binds with the APC. APC is nothing but a allergen or antigen presenting cell. Okay, suppose this is the APC. It binds with it. And this APC does what is it binds with the helper T cells. Helper T cells. Okay. They APC presents this allergen or antigen to TH, the helper T cell, and later on, when this APC gives this antigen to T helper T cell, then helper T cells gets activated. Okay, and it dissociates or deforms in another form called TH2, helper T cell 2. Okay, and after to that what happens is this helper 2 secretes a protein called IL4, interleukin 4, from itself. Yeah, and finally it becomes B cell. It forms a structure as B cells. Okay, B cells. And now what happens is this B cell forms two another cells. They are, this is memory cell and another one is plasma cell. Memory cell and plasma cell. And job of the plasma cell is to produce antibody. What? It to produce antibody. Okay, guys. The first job is of APC, antigen presenting cell, that presents this antigen to helper T cells. These helper T cells gets activated and forms into helper cell TH2 form, and then they release IL4, interleukin 4, the protein, and forms B cells. And these B cells forms two types of cell, another next cell, that is plasma cell and memory cell. This plasma cell job is to produce the antibodies in the body. Okay, guys. Okay, so after the production of antibodies inside the body, the antibody just produced is IgE. Okay, guys, this is the main player. This is the main player of type 1 hypersensitivity reaction. Okay, so the job of IgE is to do nothing but to bind with the mast cells inside the body. It will bind like this is the this is the IgE antibody, then it will bind to the cell surface like this. Okay, like this it will bind here. Now this is called sensitization phase. Okay, sensitization phase means the cell is now sensitized. Yeah, means it is sensitized against the previous allergen, the antigen. Yeah, now the cell is ready for the antigen. Yeah, whenever it encounters again, the latter it does was it releases many types of mediators like histamine, serotonin, and this type of mediators forms specific reactions in the body and gives symptoms like rashes, redness, sneezing, etc. And that we call the condition called hypersensitivity, or in a layman's language, allergy. Okay, guys. So this was the basic concept, the idea about the mechanism of hypersensitivity type 1. Now let's go thoroughly step by step. Yeah, it will be very easy to understand you for now, guys. Okay, let's move on. Okay, guys. So type 1 hypersensitivity, also known as allergic or immediate hypersensitivity. The reaction takes 15 to 13 minutes to appear. Yeah, and it could appear as a delayed response 10 to 12 hours later. It can be immediate as well as sometimes a delayed response as well. Okay, and examples are eczema, yeah, the very common allergy, the urticaria, hay fever, and asthma. Okay, guys, these are the type 1 hypersensitivity reactions type example. Okay. So under it also, guys, there are two types according to the site of reactions. They are localized reactions and another one is systemic reactions. Okay, localized reaction is also called as the atopy. Okay, guys, atopy. Localized reactions are nothing but local manifestation of immediate hypersensitivity reactions. Yeah, they are recurrent and non-fatal. Yeah. Okay. And the examples are skin, eye, nasopharynx, bronchopulmonary, or GIT, gastrointestinal tract. And systemic reactions in bloodstream, venom, or toxin, and lethal effect. Systemic reaction takes place usually in the serum, in the blood, yeah. And localized reaction takes place in these sites, in local sites, yeah, localized in a specific tissue actually. Okay, okay. Now let's talk about the mast cell. So guys, the mast cell is a very key cell for the hypersensitivity to occur, yeah, especially the type 1 hypersensitivity, that is mast cells. Mast cells are nothing but a cell that originate from the bone marrow and are scattered in the connective tissues of the body, especially skin, near blood vessels, respiratory system, and digestive tract. Okay, and they are very similar to basophils as well because they have a granules that contain allergy mediators. Actually, mast cells within have granules like a structure. Yeah, suppose this is the mast cell, then this is the mast cell, then they have a granules inside them. Yeah, have granules inside them, and they only secretes the allergy mediators, and that can be histamines, yeah, prostaglandins, serotonins, thromboxanes, yeah, and what they cause is uh, they hypersenses the antigen antibody reactions in the body, yeah, and most of the symptoms like Wilson flares, redness, sneezing occurs in the body due to this only. Yeah, so this is the main cell for the hypersensitivity reaction to occur, that we can say in a clear, in easy language. Okay, okay. So now let's move on. Okay, so this is the clear picture of mast cell. Yeah, this is the mast cell. Okay, now let's move on. Now let's discuss about the mechanism of type 1 hypersensitivity. We have roughly discussed the mechanism of hypersensitivity a bit earlier, yeah. Now let's discuss in a bit more detail now. Okay, the first phase is sensitization phase. Okay, and as we have already said, sensitization phase includes exposure to allergens, yeah, then isotype switching to IgE, sensitization of mast cell by IgE. Guys, these points will be clear a bit in more in a big picture of diagrams we will discuss on in a few seconds. Okay, and the effector phase, it is a IgE cross-linking phase, and mast cell here in this phase degranulates and releases vasoactive amines, that is histamines, lipids, that is leukotrienes and cytokines, and attraction of eosinophils occur here. Okay, okay guys, so this is the big picture of hypersensitivity reactions type 1 here. Here you can see this is the initial allergen encounter, and this is the subsequent allergen encounter, that is in a second dose, yeah. Okay, so let's see what happens actually. Whenever the allergen is inhaled, injected, or by in contact comes inside the body, then they are represented by APC, allergen or antigen presenting cells. Then they activate T cells and B cells, and finally B cell produces plasma cells, and this plasma cell will give rise to antibody, that is IgE, and this IgE will now bind with the mast cells in their receptors, the Fc receptors, yeah, like this. And now this structure is called sensitized. Now this phase is called sensitized phase. Okay guys, very clear. Okay, and now again, whenever the second attack or encounter of same allergen takes place, like is here takes place, then this allergen will bind to this sensitized phase of mast cell, yeah, sensitized phase of mast cell, like in here guys. Then what happens is cross linking occurs, and that causes mast cell degranulation, that releases what? Vasoactive amines, that is histamines, serotonins, cytokines, chemokines, and lipids. Okay guys, now after the degranulation, these hyperreactive proteins, amines, causes what is, they causes vascular smooth muscle contraction, endothelial vasodilation, leukocyte chemotaxis and activation, and cell death as well, and that give rise to most of the symptoms like redness, sneezing, yeah, wheals and flares, itching, and all over the symptoms of allergy, yeah. This is the big picture of mechanism of type 1 hypersensitivity reaction, also called anaphylaxis. Okay guys, okay. Now let's see in a bit more easier way what happens on the mechanism of anaphylaxis is IgE molecules bind to the surface receptor of mast cells and basophils. Then shocking dose. Shocking dose means the second encounter of the same allergen. Means the allergen is entering again for the second time. Okay. Okay. Now the antigen combines with the cell bound IgE sensitized mast cell, that we call. Then cross-linking between adjacent antibody molecules occur. Here you can see the cross-linking taking place. Means two antibodies cross-links for the same allergens, antigens, yeah. And then increased permeability of cells to calcium ions occur, and finally degranulation occur. Degranulation means you can see the cell burst out, and the granules comes outside of the cell and releases of inflammatory mediators. And what are the inflammatory mediators? The same histamine, serotonin, prostaglandins, thromboxanes and all. Okay. Okay guys, the same thing is discussed here also for a more clearance. The final big picture for understanding the mechanism is here. This is the mast cell. This is the IgE antibodies produced against the allergens. This will bind with the mast cell and form a structure binding of IgE on mast cell and form a structure called sensitized structure, the sensitized phase. And whenever again the allergen bind, the same allergen bind, then the cross-linking occurs between antibodies for the same allergen, and then degranulation occur and release of inflammatory mediators occurs, and this is called the anaphylaxis. This is the mechanism of anaphylaxis. Okay guys. Okay, now let's see about the mast cell inflammatory mediators. What are they? Okay, so biogenic amines, they are histamines, bronchial constriction, and mucus secretion from goblet cells. Goblet cells are mucus secreting cells in the body. Yeah, vasoconstriction and capillary endothelial vasodilation, increased vascular permeability, fluid loss, and shock. Okay, so this is the job for the histamines, the mediator, inflammatory mediators inside the body. Yeah, okay. The another one is lipid mediators, and they are nothing but leukotrienes that are similar to histamine proteins. Yeah, and PAF, platelet aggregation factor. They are microthrombosis. They are thromboxanes actually. Yeah, they deal with the platelets and forms the coagulation of blood and tissue damage as well. And prostaglandins due to edema and pain. Yeah, prostaglandins and thromboxanes goes with the cyclooxygenase pathway, lipid oxygenase pathway, and that does affects the pathways and metabolism and does give rise to this incompatibility inside the cell. Okay, the cytokinins TNF. Okay, so guys, this is the clear picture for the urticaria. Yeah, you can see here the braces. Yeah, Wilson flares, the redness. Yeah, this is the eczema, redness, itching that occur due to the localized reaction on the skin, the atopic reaction. Yeah, hypersensitivity type 1. Okay, now let's deal with the prevention of anaphylaxis. Guys, the only prevention, the major clear cut prevention, yeah, is the avoidance of the responsible allergen. Mean, suppose you have allergy of something like dust, pollens, flower pollens, yeah, insect venoms, anything. Actually, allergens can be anything. Yeah, you can't count on fingers about the allergens. It can be anything. Yeah, so just avoid the responsible allergen and you will be safe from the hypersensitivity reactions. Okay, keep an adrenaline kit. Example is EpiPen and Benadryl on hand at all times. Whenever this reaction occurs, you can use it and you can prevent it from it. Okay, now medic alert bracelets should be worn. Venom immunotherapy is highly effective in protecting insect allergic individuals. Okay guys, so this was the prevention. And another one is desensitization. Yeah, desensitization is an effective way for prevention of systemic anaphylaxis, and it is of two types actually: the acute desensitization and chronic desensitization. Okay, and acute desensitization involves the administration of a small amount of antigen, yeah, very small amount of antigens, to which the person is sensitive at an interval of 15 minutes, only 15 minutes. Okay guys, in acute desensitization. And then what happens is the complex of antigen IgE is produced in small quantities, hence enough mediators are not released to produce major reactions. Yeah, so this is the concept for acute desensitization. And another one is chronic desensitization. It involves the chronic desensitization. It involves the long-term administration of antigen to which the person is sensitive at an interval weeks, 2-3 weeks. After the 2-3 weeks, it is given to the patient for the desensitization. Yeah, actually what happens is it stimulates the production of IgA and IgG, blocking antibodies that prevent subsequent antigen. Okay, so guys, this is the concept for desensitization, which is also the prevention and the management of hypersensitivity type 1 reaction. So guys, this was the big picture, picture, and this and explanation for the hypersensitivity reaction. Yeah, there's nothing more to discuss on this. We have discussed the overall concept, the overall idea for the hypersensitivity reactions. Okay guys, so thanks for watching. I hope the video is quite effective for you to understand the hypersensitivity reaction in an easy way. Go through the video once again, and if you found the video effective, please hit the like button. Do subscribe and comment. Yeah, do subscribe the channel. Okay, so guys, this much for today. Bye bye. See you again in next video. Okay.